Well, this week marks Sleep Awareness Week. It's probably safe to say most of us are pretty aware we would like more sleep, especially as new parents. But there are some things we can do to get more rest. Joining us to talk about some of those is Dr. Richard Chaffoo. Thanks so much for being here as always.
Thank you, Jen.
It's National Sleep Awareness Week. The CDC called insufficient sleep a public health epidemic. That's a pretty serious charge.
It really is, Jen, and the problem is that there are significant health risks with inadequate sleep. We know that inadequate sleep is related to psychiatric disease, from depression to substance abuse to medical conditions like diabetes, heart disease. We know an inadequate amount of sleep allows for people to drive very drowsy at night, and we also notice it's responsible for inattentiveness and lack of memory. So those are the important things, and there are some causes of sleep apnea, of problems with sleep. One of those is sleep apnea, the most common. Pain, discomfort. About 60% of people with pain also have problems with inadequate amounts of sleep, and alcohol as well is associated with inadequate amounts of sleep. Although it's a sedative and it'll put you to sleep, once your blood alcohol level drops, you'll wake up again and you won't get an adequate amount of deep, or what we call REM sleep, and that's the part of the sleep that's missing in all these situations.
Dr. Chaffoo, talk to me about new research that I was reading about. Actually, we say we want to get more sleep, but there's also the other side that says if you get too much sleep, that's not good either. So
exactly,
what's the claim for that?
Well, it's an interesting study that just came out of the University of Cambridge, and they looked at 10,000 people, and they looked at those people over a 10-year period, which is pretty a large study, and they found that about 300 of those people suffered strokes. And if we discount heart disease and other risk factors for strokes, what we found was that those 300 people that actually developed strokes or cerebrovascular accidents were people that slept more than 8 hours a night. And the studies seemed to indicate that if you slept more than 8 hours a night, it actually doubled your risk for a stroke.
Yeah, up on our screen now are some sleep recommendations, because Dr. Chaffoo, they really do vary.
They do, Jen. So you can see the sleep recommendations in newborns and infants. Obviously, is about 12 to 15 hours. And as we get older, of course, we need less and less sleep as our neurological brain systems mature. By the time we're about 18 years of age and older, we only need between 7 to 9 hours of sleep, but we do need that much sleep.
Yeah, that definitely good. I am always an advocate of saying, hey, I need at least my 8 hours, though I would prefer 9.
Right.
Talk to me lastly about some tips to get a better night's sleep. This sort of seems, when I was reading your notes, like common sense, but then when you really think about it, I thought there's a lot of us that really don't follow some of these basic guidelines.
Exactly, Jen. So the big thing is we have to put it on our priority. It's got to be on our to-do list, number one. Number two is I always recommend at least a few hours before you get to sleep, you don't want to eat or drink any alcohol. You want to have a consistent schedule. So about an hour before you go to bed, you want to take a hot bath or a hot shower, have some soothing music, and then you want to make sure where you go to sleep, it's a very quiet environment. It needs to be cool, comfortable mattress. And then you want to be free from distractions. It's not a place to get on your iPad or phone or watch television. And again, it's got to be a top priority to make it happen.
And hope that your partner doesn't snore.
Very important, right?
Dr. Chaffoo, thanks so much. Appreciate your time.
Thank you, Jen.